All right, I think we're good. Welcome to the Evergreen Person Status and Discharge session. My name is Leslie Miska, and I'm the Office of Aging and Disability Services Information Services Manager, and I will be leading today's training session. Next slide, please, Miranda. During today's training session, we will cover the following topics: an introduction to Evergreen, the person status workflow, and the discharge form. Next slide, please, Miranda. Prior to this training, you should have watched the Evergreen microlearning videos. If you have not yet had a chance to watch them, you still can. They're out on our project website at maine.gov/dhhs/EIS/evergreen. The videos provide the following topics, training for the following topics: search, which is an introduction to Evergreen and the search process to access and how to access person records, staff records, location, and organizations. Dashboards, which there are two different types of dashboards in Evergreen. There's one for you, the user, or the staff dashboard, and there's also dashboard for the person records. There's also a microlearning on the person record itself, which is where we collect all of the demographic and personal information, as well as health information, which is a comprehensive collection of all the data points like diagnoses, allergies, medications, health insurance, etc. And there's microlearning on queries and notifications, which are two different tools that will help you manage your outstanding actions in the system or work that you need to complete. There's one for progress notes, which will show you how to create a progress note if your role has access to do so. And then one for uploading attachments to the person's record for important documents that will supplement the information that's captured in the Evergreen system. Please note that we will not be covering all these topics today, so you'll want to be sure that you do watch the microlearning videos if you haven't already, and you can always watch them again as a refresher if you choose to. Next slide, please, Miranda. Participants have been added to this training in listener mode. Therefore, your line is muted. We do want to hear your questions though, so please find the Q&A icon in your Zoom window menu. And if you don't see it right on the menu, it might be under the more three-dot icon, the ellipses icon. So go ahead and find that, open that up. You can type questions into that throughout the presentation. And at the end of the slides, I'll certainly answer as many questions as we have time for. We should have ample time to get through your questions on today's call. But if for some reason we can't, we certainly will make sure to answer those questions and likely post those on our frequently asked questions on our website. Next slide, please, Miranda. There are two different sides of Evergreen or sections of Evergreen. There's the Adult Protective Services side of the system. This is where we collect APS reports, capture APS reports. And then there's the Evergreen Person Record side of the system. This is where we're going to focus our training for today, because this is where our EIS functionality is going to move onto the Evergreen Person Record side. However, the Evergreen Person Record itself, where we capture all of the relevant person details like demographics, identifiers like a number, Social Security number, health insurance, health information, that is a shared record. So our Adult Protective Services and Public Guardianship Conservatorship staff will also have access to view and edit the data captured at the person record level. Next slide, please, Miranda. Some of the benefits of Evergreen include a robust help center, which also has the ability for you to reset your own password, the ability to upload attachments to the person record, the ability to print forms as you see them on your screen, just using the global print feature, which is the control key on your keyboard plus the letter P. And then an enhanced person record with centralized data capture. So again, we have that centralized person record where we're going to be capturing all the demographic information, health information, some history items. This way, data is captured in one central location, managed there by all the people who have access to manage the person record. And then in addition to that, we also have the ability for person records to be linked with and receive automatic updates from the main integrated health management system, or MIMS. So, for example, an A number, program and financial classification, diagnoses, medications, medical professional contacts, all of that information will flow into the person record in Evergreen from MIMS when that person record is linked to a MIMS record. We also have the ability to display that common data that's captured at the person record on forms rather than having you recapture that on each individual form. So, for example, if a form needs the person's assigned case manager or their program that they're classified on, or some of their history information, certain categories, or diagnoses, allergies, things like that, those things can automatically display on forms rather than you needing to recapture those. We also have some standardized data capture. So certain fields are required. That will be indicated with a red asterisk and or a yellow bar at the beginning of the field itself. There are field level validations. So if you're entering data into a date field, the system will make sure that the date is in the appropriate format, or it will tell you that it's not. Also, like if you were typing into a numeric only field, it would make sure that you're only using numbers rather than alpha characters and numeric characters. And forms have set workflows and sometimes built-in business rules to help us capture data in a standard way for better reporting. And then the system itself is web-based and is it can size down to a tablet size, so you can use it on your desktop, laptop, or a tablet. It may also work on some smartphone devices depending on the screen size, but we cannot guarantee that all of the functionality will resize properly for a cell phone device. Next slide, please, Miranda. My dashboard is the first page that you as the user or staff member will see upon logging in. At the very top of this page, you'll see the white persistent top-level navigation. There's the Evergreen logo, and then to the right of that, you'll see a search bar. You can type keywords into this quick search and hit enter, and it will provide you your search results. Or you can use the two icons to the right. The one just to the right of it that looks like a clock is the search history. This will retain your last 20 searches for more efficient searching. And then the icon just to the right of that looks like a magnifying glass with a plus in the middle of it. This is your advanced search. So you can click on this and it will allow you to type your keywords into the specific field that you're wanting your results returned from. For example, last name. And then there are some other icons across your persistent navigation depending on your role that you can access from any time when you're logged into the system. Underneath of that persistent navigation is your dashboard. This will also be dependent on your specific user role. When I took this screenshot, I was logged in as a case manager or care coordinator. You as case managers and care coordinators will see all of these tiles where some other user roles will have less tiles. Starting in the top left, the tile with the orange background is the announcements tile. This tile is managed by our vendor, FEI Systems, and it will have announcements or alerts that are specific to all users of the system. So it will let you know if there's potentially some scheduled maintenance and there's going to be a system outage that we're aware of, or that there's maybe an office closure coming up. So maybe your help desk is not going to be available for you during that time, or other things that maybe need to be sent out to all system users. The tile just below that is the My Notes tile. This is a feature that's similar to sticky notes or notepad that you might have used on a smartphone device or a tablet or even your laptop. And this allows you to just be able to capture a note title and note content quickly, and that will store against your My Staff profile. And if your role, like as a case manager or care coordinator, allows you to create progress notes, you can later promote that note to a person level progress note if that's appropriate. If it's just a reminder for yourself or a little note for yourself, you can just leave it stored in your My Profile. In the center at the top is the caseload tile. As a case manager or a care coordinator, you will have a caseload tile. This will be a list of person records that you are actively assigned to. So once a case manager assignment is made for you, the person will show up in this list. And once that assignment has been terminated, then the person will no longer show up in this list. This is a quick way for you to navigate to the person records that you are the assigned case manager or care coordinator for. Underneath of that is the messages tile. This feature is similar to email, but it's contained within the Evergreen system, and it can be used for communicating with other system users, such as community case management liaisons, or possibly a public guardianship representative. The tile to the far right is the My Tasks tile. This is a feature that's similar to Outlook tasks. You can create tasks for yourself, again, things that you need to remember to do, and the system will show you when they're overdue here or coming due. And also your supervisor can assign tasks to you here. Next slide, please, Miranda. Before we review the discharge form and process, let's take a look at the common person status workflows. Next slide, please, Miranda. So starting at the top here, I want to go through the common or happy path developmental disabilities workflow. So typically when a person comes in new to service, they will be referred to our office through the developmental disabilities referral process. At this time, the person does not exist in the system, so they don't have a record at all. Then the referral information is captured in our contact form, and that will be captured by our developmental disabilities intake and eligibility staff or admin staff who answer the call. Once consent is received to complete the DD intake and eligibility assessment, the DD intake and eligibility staff will create the person record if it doesn't already exist in the system. Then that same staff will create a DD eligibility assessment form. This will automatically set the person's status to DD intake. And that status will show up in their person record banner. And then once the DD eligibility assessment has been completed, it will be marked as either DD eligible or DD ineligible, and the person record status will update correspondingly. I'm going to continue on the happy path, indicating that they were found DD eligible. If DD eligible and the person accepts their case management services, and then the DD intake and eligibility staff will create a case management acceptance form. The community case management liaison will use this form to create the case management location assignment. If the case manager was also known at the time that that form was created, then the community case management liaison can also make the community case manager assignment itself. If not, then a supervisor within the case management agency will make that case manager assignment. Once the case manager assignment has been made, then the person's record status will update to Section 13, indicating that they are receiving targeted case management. Once that has occurred and the case manager has been assigned, the case manager or care coordinator, well, we'll do care coordinator afterwards, the case manager will create an initial comprehensive assessment, which the comprehensive assessment is a new form that replaces the BMS 99, psychosocial, and parts of the V7. The other parts of the V7 have been incorporated into the person-centered plan itself. So they'll create that initial comprehensive assessment, and then after they've completed that, they'll create the initial person-centered plan. And once that person-centered plan will likely have proposed waiver services, because the individual is likely trying to apply for Section 21 or 29. Again, we're going with the common scenario here. So once they've completed that PCP, the case manager will then create an application packet. They'll attach that comprehensive assessment and person-centered plan to that application packet for either Section 21 or 29. That packet will submit to our waiver manager, And the waiver manager will review that packet in the attached forms and determine whether the individual is medically eligible for that program or not medically eligible for that program. And that information will be added to the application packet. Again, going with the happy path, if the person was found medically eligible, they'll be added to the wait list under the program management area of the system. Once an offer has been made and the person accepts the offer, then the case manager will revise the comprehensive assessment and person-centered plan and update the program to either Section 21 or 29. Once the plan is completed, the case manager will create a classification packet and they'll attach these revised forms. The classification dates will align with the person-centered plan dates. And then the resource coordination team will review that classification packet and enter the classification details directly into the main integrated health management system, MIMS. That evening that the classification was entered into MIMS, it will flow back into Evergreen and the person records status will update to whichever section of program policy they are now classified under, Section 21 or 29. The person will stay in this status so long as their person-centered plan keeps getting updated annually and their classification keeps getting updated annually. If for some reason their classification ends prior to the end date, it doesn't get updated timely, then the person's status will work its way backwards. So if the classification ends without being re-upped timely, the status will go back to Section 13 because the case manager is still assigned. Once the person passes away, or if they voluntarily terminate services, that's when the person's status would then change again. If the person passes away, the date of death will be added to the person record and the status will then show as deceased. Moving on to the brain injury workflow, again, going with a common scenario, the person will be referred to our office. At this time, they likely do not exist in the system. The person will then be referred to Maximus for their assessments. The outcomes and scores will be entered into Maximus's Assessment Pro. If the individual was determined BI eligible, then the BI case coordinator will create the person record in Evergreen and they'll create a level of care form. And this is in the level of care form is where they'll enter all of the Assessment Pro outcomes and scores. Then they'll create a BI application packet. And once they create that BI application packet, the person's status will show BI intake. Once the offer is made and the person accepts it, the brain injury case coordinator will create the PCP and a classification packet, and they'll assign a care coordinator. The classification will then be entered into MIMS and it will flow back into Evergreen that evening. And that's when the person's status will change to Section 18. Again, as long as the annual application and classification information is being updated timely, the person will remain in Section 18 or 102 if they're receiving 102 in perpetuity, unless again that lapses or the person passes away, at which time the date of death should be added to the person record and then their status will show as deceased. Next slide, please, Miranda. The discharge form should be completed whenever a person is no longer receiving services. Next slide, please, Miranda. To create the discharge form, the user should navigate to the person's record, click on the Forms and Plans icon in the green primary navigation menu on the left side of the screen. I've circled that icon in red and Miranda's showing you where it is here, and the background appears white because I was clicked into that page when I took this screenshot. Clicking into this on this icon will take you to the All Forms list page. From here, you'll click on the plus new form button in the upper left-hand corner of the central content area. This will open the pop-up modal that you're seeing in the center of the screenshot. From here, You'll choose Discharge form under the Case, Care, Plans, and Forms category, and then you'll move to step 2 in the stepper. Next slide, please, Miranda. In step 2, you will select the program that is being terminated. Options include DD, BI, ORC, which isn't in the system yet, and then Adult Protective Services. You'll provide a date of discharge, and you'll choose the reason for discharge from the following options: deceased, moved out of state and chose to terminate services, chose to end services, no longer chooses to receive Evergreen managed services, department involuntarily ended services, or termination due to no contact, termination of guardianship conservatorship and does not receive Evergreen managed services other than guardianship conservatorship. And then you'll provide any additional comments related to the discharge. And you can see here in this screenshot, I hadn't typed anything into the comment field so that you could see the ghost or guiding text that's available in that comment field. This is giving you an idea of what types of information you might want to put in that comment field. You can also find that same information by clicking on the light bulb icon to the right of the field label comment. The reason for that is once you start typing into this comment text box, all of this guiding text will disappear, and we wanted you to be able to access it from the information icon light bulb as well. Next slide, please, Miranda. Upon saving, the form will be created and the system will navigate you into the discharge form. Like other forms in Evergreen, the discharge form will be in a status of in progress. However, different from other forms in Evergreen, the completion requirements will automatically display green check marks indicating that the required fields for submission have already been populated. And that's because you've completed all of the fields that you need to populate during the creation of this form. However, before the form is set to complete, you should review both sections of the form, the overview, which was populated from your create modal, and the discharge information. These are pre-populated, but in addition to that, the data captured, in addition to the data captured, you will also be presented with a discharge checklist. This checklist will be customized based on the reason that you chose for the discharge. So in this example, I had chosen a reason of choose to end services, no longer chooses to receive Evergreen managed services, so a voluntary termination. And my discharge checklist is specific to that reason. The system provided me with the following checklist: verify that their address is updated in the person profile, document and upload a discharge summary in the attachment section under discharge documents, obtain signatures on the voluntary termination of waiver services document and upload that in the attachment section under discharge documents. If a form is in progress, close the form with a reason of member declined, if applicable. Not all forms will require that, and document the appropriate information. Reversion the PCP as a change type with a change reason of change in service support, and zero out and end date all waiver services in the My Life Planning section. End date the non-waiver and natural support services accordingly, and fill out the change in waiver services section for the resource coordinators, and unassign all waiver providers. Next slide, please, Miranda. The next step in the discharge process is to complete the actions that are outlined in the discharge form checklist. So I'm going to steal the screenshot from screen share from Miranda, and I'm going to go ahead and demo some of this for you. Please bear with me because I am in a test environment, so it's a little bit slow sometimes. And sometimes we run into some challenges in our test environment because they're constantly working on little things in here. Looks like I have too many things open on my computer this morning. It's not liking me. Oh my. Fingers aren't typing yet either. I'm logging in as a super user here, so you're probably going to see more functions and features than your role has access to. but this just makes it a little bit easier for me to show you all these things without having to log back in and out. So I've typed the record that I wanted to look for in my status bar here, my search bar here, and I hit enter and it's provided me one matching result. And I simply just click on this result row and it will bring me right into that person's record. So you can see here, I'm in Leslie Status's person record. This is Leslie's person dashboard. And I can do the first thing on my checklist by going to the person record. So I need to first verify her address. We want to make sure that we have an updated address for Leslie before we discharge her. So I can open my quick scroll menu over here on the right, and this will give me all the different sections of Leslie's record. And I can quickly navigate to the addresses section by clicking on address. And I can see here that I do have an address for her, and I can verify that this is her correct address. And I can, if it isn't, I can edit it. If I need to add an additional address, I can do that. Then the system told me that I should upload her discharge summary. So I'm going to go back over here to her navigation, and I'm going to select the attachments icon. This here is where all the attachments for Leslie have been uploaded. In my demo that I did last week, I already uploaded these documents, but I'm going to go ahead and just do it again and show you how this works. So from here, you would click on the plus new attachment. You would look for the attachment that you had completed and saved to your device by using the choose file button here. This will open up your computer's document files. So I had already saved these for this training to my desktop here. So I'm going to go ahead and upload the discharge summary, and it will show me that I've uploaded that document right here. That's the file name. And then I'm going to select the category of discharge documents because that's what the checklist told me to do. And the start date will default to today's date. You can put an end date on this, or you can leave it open where this is an active discharge document. You could probably leave that end date open. And then you just want to give it a little short descriptive title like discharge summary. And then click save. This will add that document right to the top of my attachments list here. Then the checklist told me that I should also upload an attachment of the voluntary termination of waiver services. Again, you would have completed this, gotten the signature, and you'll just search for that on your device. Click open, it will show you that it's uploaded that. You'll again select the discharge documents category. You can leave the end date open and you can say this is the voluntary termination. Let's see. And then it will just show me that I've attached that one right there as well. So I'm going to stop sharing and give this back to Miranda so we can go through a few more slides. To revise the person-centered plan, you will need to click on the Forms and Plans icon. This will take you to the All Forms list page. From here, you will need to use the upside-down pyramid hamburger filter icon in the upper right-hand corner of the central content area to navigate to the Custom Person-Centered Plan Forms list page. Once there, you will locate the active PCP and any in-progress PCPs, if there are any, that need to be closed out. You'll click on the ellipses or the 3 vertical dots to the far right of the record that you need to revision. And you'll select the option of revise. Next slide, please, Miranda. The system will provide the revise pop-up modal. Choose the PCP type of change And then you'll select the change reason of change in service and support, like your checklist told you. And you should also select the reason of change in service implementation and then hit save. Upon saving, the system will bring you into the person-centered plan where you can navigate to the My Life Planning Services and Support section. So you might want to use that little toggle in the right and navigate to that section a little bit quicker. Note, you will need to click the edit toggle in the upper left-hand corner of the content area to modify any data. You should open each waiver service and update the units, hours per week, invoice amount, etc. to 0. So when I took the screenshot, I'd already done that. So I wasn't in edit mode, I was in view mode, and I'm just showing you that I'd already completed that activity. But you're going to want to open each individual waiver service and 0 out the units, hours per week, invoice, whatever the label is there. If there are natural or non-waiver services that you also want to end, you can do that as well. Next slide, please, Miranda. Once all of the services have been zeroed out, you should navigate to the change in waiver service section, which is also under the My Life Planning. And then once you get there, again, you're going to want to be in edit mode and you're going to want to select yes under the question, are there any changes to waiver services that impact service authorization? And then provide a description for the resource coordinator indicating that the person has chosen to terminate services and all of the PAs should be ended. My description probably wasn't that great here. I just said zeroed waiver services, but you might want to just let the resource coordinators know that they're terminating their services and that they should end the PAs. Then using the status dropdown, you should submit the plan for state review. This change in status will trigger a notification to the resource coordinators letting them know that the PAs should be ended. Next slide, please, Miranda. After zeroing the waiver services, updating the change in waiver services questions, and submitting the PCP for state review, you can now use the status dropdown a second time to select the status of close. The system will then present the close pop-up window that you're seeing in this screenshot. You should select the reason for closure. Choices include created an error, member withdrew, member deceased, or admin edits. So in this case, you'll want to select member withdrew. If the person passed away, you should select member deceased. Next, then provide any pertinent closure comments and click continue to complete the PCP closure. The system will then auto close all associated service implementation plans or SIPs with a closed reason of PCP closed and a comment of the PCP that this service implementation plan was linked to has been closed. The change in status will also trigger notifications to the resource coordinators and BI care monitors to terminate the prior authorizations. It will also notify the DD waiver manager and BI waiver manager to terminate their program classification. And it will notify the community case management liaison or BI care monitor to end the case management assignments. Next slide, please, Miranda. I am going to steal the screen share again. And I'm still logged in here. So I'm going to navigate back here and show you on the person record. If the person passed away, this is where you would enter a date of death. And hit save. And once you do that, the person's status has now updated to deceased here. Also, the assignments can be found under the assignments icon, and you can see the active community case management assignment here. And you can also see the active community case manager assignment here. And those can be inactivated by the community case management liaison, or the case manager can be done by the supervisor at the case management agency, and then the location assignment can be done by the community case management liaison. Either of those options are appropriate. And I'm going to stop sharing and give that back to Miranda again. So this concludes the steps in the discharge process. And while I'm going through the next steps here, if you have any questions, please type those into the Q&A icon now, and we'll definitely answer those. I think we have a few already queued up. But in the meantime, I did want to give some additional information about next steps. So the next steps will be to start practicing in the system yourself. This Friday and probably trickling into early next week, we will start sending out the individual emails. We're going to send an email to every single system EIS system user. It will have the login to our sandbox training environment. So it'll have the URL and the credentials that you should use to log in. Now, please note that these credentials will have more permissions than your production role will have. And that's again because we want you to be able to navigate around in the system and try things out without having to actually have other system user roles move forms into certain workflow statuses or add things to the person record. We want you to be able to do that yourself. So your login will have more permissions than your production role will have. You will also receive a person record assignment. That person record is yours. That's your record to play around with in the system. So you can do whatever you'd like. You can add things to the person record, edit things on the person record, delete things on the person record, add forms, edit forms, revise forms. Really just familiarize yourself with the system and do whatever you would like that will make you feel comfortable before we go live in January. If you're having trouble logging in, please reach out to us because we don't want you resetting the password on that user profile in this system. That will lock out all of the users that have been assigned that same set of credentials. It is being shared, so please don't reset the password. That's very important. In the meantime, while you're waiting for your email and to be able to get into the training environment, you can go to our website at maine.gov/DHHS/EIS/Evergreen, and you can rewatch the informational webinars or watch them for the first time if you didn't get a chance. There's one related to the person record and new features. There's one related to progress notes and reportable events. There's one related to the PCP process and how it auto creates prior authorizations. You can also watch those micro learning videos if you haven't had a chance to do that, or rewatch them if you'd like to hear them again. You can go and rewatch the recorded training sessions. We did provide this session already last week, and that should be posted on our website soon if it's not already there. I forgot to check this morning. And you can also listen to any of the other recorded training sessions if any of those topics interest you. You can read through the frequently asked questions that are out on our site. We'll also be updating that as well with the questions from the training sessions last week. And then we're also asking that you tie up any loose ends. So if your role as case managers and care coordinators, it does allow you to create reportable events and progress notes. We're asking that you get those into a completed state by 5 p.m. on January 12th, 2024. This is because those two forms or modules they'll migrate in a closed status. So you won't be able to edit them once they migrate over. Other forms, though, you will be able to edit once they migrate. So like the person center plan, it will migrate in whatever in progress state it's in, and you'll be able to edit it and complete it in Evergreen. But if you have a note that's in progress, it's going to be locked down and you won't be able to edit it anymore. So we want to make sure that you get those completed. Worst case scenario, you don't, and then you may need to just re-enter that progress note, or you may need to re-enter a reportable event if you weren't finished with it. You can also sign up for one of the Q&A sessions that's being offered the week of January 8th. Those are being offered by our vendor FEI Systems, and they're intended to be a true hour of just taking questions and answering those the week before we go live. This will allow you time to complete all of your related technical trainings and navigate around in the training environment and bring whatever questions you might have to those sessions to get answers real time. You can also email us at any time with any questions that you have at evergreen.dhhs@maine.gov. Next slide, please, Miranda. So we have officially made it to the question and answer portion. I do have some questions in the Q&A, so I'll start going through those. But if you have any questions, feel free to type those in now. Melinda asks, what is the process of the member if the member chooses not to have Section 29 or 21 services? Great question, Melinda. So I suspect that someone could continue to receive case management services and not go on to waiver. I'm not the expert there, but if they have been found DD eligible and they've accepted case management services, then they can get an assigned case manager. And then there is no necessarily uh, requirement to go on section 21 or 29. But I'll certainly make sure that we provide an accurate response to that question on our frequently asked questions site. I'm not sure if anybody else is on the call that might know the answer to that. Just quickly scan down through. I don't know if Lisa knows that answer or not. I don't know, Miranda, if you can unmute Lisa. I'm not sure if she knows whether an individual can just stay on section 13 indefinitely.
Hi. I am not sure about that. I think we need to take that back to
Okay.
Angela.
Okay. We'll definitely get an answer to that question, Melinda. Sorry that we don't know the answer to that right offhand. Thanks, Lisa.
No problem.
Cheryl asks if we could if the workflow could be broken down into each step for either case managers or care coordinators, like an instructional guide. Thank you, Cheryl. We can certainly take that suggestion and we can attempt to get a step-by-step workflow for case managers and or care coordinators.
Leslie, really quick, I can answer that last question.
Oh, thank you. I didn't know if you had a voice. That's why I didn't call on you, Nancy.
You got it. This is yeah, not much, but it's my understanding that targeted case management, section 13, once someone's endeavored eligible, they're eligible for life. At this point, they are allowed to have case management if they're eligible.
Okay.
That hasn't changed. Other areas, sometimes in other programs, not like brain injury and stuff like that, case management isn't an entitlement.
Okay, thank you. So for DD, then section 13, once they're determined DD eligible, they can have section 13 targeted case management as in perpetuity. And they don't have to apply for a waiver. Okay, great. Thank you. Appreciate that.
Currently.
Michelle asks about termination due to no contact. What is the normal time frame on that? I've had a client over the last year that has gone several months with no contact, and then when stress due to environmental stressors will reach out. With this being said, the client was sent injury letters asking if they still wanted to engage in service delivery also. Just curious, as I thought a client could not be discharged without their consent. Great question, Michelle. There are some time frames built into rule about involuntary termination due to no contact. I do think the time frame is quite long, and I don't remember it right off the top of my head. I think it was shared with me several years ago, but I can't recall that right off the top of my head. So we'll certainly provide that information in our frequently asked questions for you. Lisa asks, can you talk a little bit about the different user roles in Evergreen, super user, regular user, etc.? Great, I certainly can, Lisa. So there are, shockingly, almost 70 roles, 70 different distinct roles in the system. We had hoped that we would be able to minimize the number of roles in Evergreen. There are almost the same number in EIS. Unfortunately, roles are how we control access and also how we send out and trigger notifications to different user groups and provide different queries that are ways that you can determine what outstanding actions you need to take in the system. So because of those types of things, we actually needed to have all these distinct roles. But there are roles that start with the most level of access, which is my team, and we have super user or ODES administrator access. And then it goes all the way down from there. Some of our ODES staff that are management, associate directors, they have sort of full access to all person records and all forms and all that stuff. And then it goes down from there where case managers and care coordinators have probably the next level of access. They have explicit assignments to their persons that they serve, but they can access and view all of the forms and attachments and things like that for that person that they're serving, that set of persons that they're serving. And then other roles like community case management supervisor will also have that same level of access. And then there'll be like different provider roles. So there's like a service implementation plan provider role. Those individuals will be able to see person records that their organization serves. So the person's record will have a location assignment under that organization, and those users will not have explicit relationships to the person records, but they'll have access to person records that their organization has that relationship to. And they'll be able to see certain forms within the system. So they'll be able to see service implementation plans, for example, but they won't be able to have access to view maybe the full person-centered plan or comprehensive assessment or other forms that the case manager will have access to. And then there are users that are just in there for reportable events, for example, reportable event providers. And they don't have any other responsibilities in the system. So they'll just have access to the person records that, again, their organization has a relationship to, and they'll maybe only have access to the reportable event form. Same thing, like some progress notes will be available for providers where others won't. So the general note that the case managers and care coordinators use will not be available for providers to view. But the provider note, like the home support note or the provider exploration and discovery progress note, will be viewable to case managers. So there's lots of different roles and levels of access. And also depending on some of those roles, you will receive different notifications and that kind of thing. Hopefully that answers your question. Lisa gives you a little bit more information about that. Michelle asks, where is the save button listed under the person-centered plan tab? Just want to make sure it either auto saves or know where this is located, as EIS would always time out and thus things needed to be started again from scratch. Yeah, great question, Michelle. So when you're in the person-centered plan PCP tab, you need to be in the edit mode in order to see the save icons in the person-centered plan. So when in edit mode, down at the bottom, you'll see some page navigation pop up. There'll be a left-facing arrow and a right-facing arrow, and then in between that, you'll see a save button and then a save and next button. And that's how you'll like page through each page of the PCP, or you can use that quick scroll navigation to get to whichever section you're on. And then once you enter the content there, if you're just entering in that section and you don't need to keep moving through each page, you can just hit save. Or if you're like adding information and moving through, you can hit save and next, and it will save and then move you to the next page. But also just to know that the Evergreen timeout is much more user-friendly than the EIS timeout was. So if you're navigating at all, so even if you're just paging through or scrolling through, or maybe even just mousing over content, the Evergreen system will not start the timeout clock. It will only start the timeout clock working its way down when you are literally sitting, staring at the screen and not moving anything, not moving your mouse, not keying on anything, not, paging through or anything like that. That's when the timeout would start. And then it will present you a little pop-up that says, hey, warning, you're going to be booted out of the system. And you can just click to stay in the system. You can say, I want to stay in the system. So the only time that you would truly be bumped out of the system is if you'd maybe looked away from your computer, you got distracted by a conversation or a phone call, or you'd walked away. So if you you know, are taking a call or somebody comes in, I would recommend just hitting save on whatever page you're on. That way, in case it does time out on you, you don't lose any content there. Lisa asks, will there be new protocols available online or elsewhere that go through these steps when we need to use them? Yes, great question, Lisa. So we are creating our vendor is creating a user guide that will be sent out to you in our January communication. So we plan to send a communication right in early January, reminding you of the upcoming deploy, reminding you that you should, you know, complete your progress notes by 5 o'clock on January 12th, that you should complete your reportable events so that you don't have to re-enter that type of stuff. And we'll also attach the user guide. The user guide will be a technical guide, so it will teach you how to technically navigate the system and find different things. In addition to that, we are trying to update some of our common manuals and guides prior to deploy. So for example, for the developmental disabilities population, we're going to try to get the person-centered plan manual updated. And then we'll probably be updating a few other guides and manuals and step-by-step instructions that we currently have that refer to EIS, and we'll update those with Evergreen process and slides. However, that will be ongoing as well. So, and we're also recording all of these training sessions, both the informational webinars, all of the FEI-led technical sessions, all of our business process training sessions that are happening in January. Everything's being recorded. Everything will be left out on our project website, and we'll likely upload these into the Evergreen system itself. So you can refer to these at any time for step-by-step instructions on different things. And we'll be, you know, once we go live, as we're providing ongoing support to all of you and the questions that are coming in, we'll likely be creating additional little short video clips like the micro learning clips that are just a couple minutes long, and they show you how to do things that we're receiving common support requests for. So all that stuff will be shared out with you. It'll be added to our project website. It'll be added in the Evergreen system. And we really want to make sure that you are supported and your questions are answered. And a lot of these things are also out on our frequently asked questions on our website. And also, as part of that January communication, we will be sharing with you all of the post-deploy support options that are available to you and where to go and how to get help if you need it. Aaron asks, would we use a similar discharge process for when individuals choose to transfer to a different case management agency? No, you do not need to use the discharge form for transfers to a different case management agency. You would handle transfers to a different case management agency, though, the same way that you currently handle those in EIS. I believe you work with the community case management liaisons and request that they transfer the person to that new case management agency. So you'll want to continue to follow that process for a change in case management. The discharge form should only be used when a person is going to no longer receive services at all, whether they've passed away or they've chosen to terminate services because they're moving out of state, or they just don't want to receive services anymore. They're still in state, but they don't want to receive them, or there's an involuntary termination. Michelle asks, what steps are taken if a client wants to engage in self-directed services? Yeah, great question, Michelle. So self-directed services are an option for some of our waiver programs now, and the process is basically the same. The difference is in the person-centered plan, there's an option for self-directed services. So the case manager or care coordinator would still create the person-centered plan, still do all of the same stuff that I had said up to the person-centered planning process. And then in the person-centered plan, you would select the self-directed service option rather than waiver service for those services that they would like to self-direct for. But aside from that, the process is pretty much the same. They will have a fiscal management services agency that will have to help them manage those services and that's all part of the person-centered planning process. So if you're familiar with how that's working in EIS, it will be a similar process in Evergreen. Esther asked, for brain injury, section 102, I add people, but they do not go through Maximus, case management, etc. I just add them in order to create an authorization for rehab services. Yeah, great question, Esther. So you'll will create the person record. You'll create the person record in Evergreen, and then you'll just automatically be able to go to the prior authorization module and authorize those section 102 services. So, and you'll be able to still put the, I think there's still a classification possibly for section 102 that goes into MIMS. So that will still get entered into MIMS and then flow back to the person record once it's created. So you'll just bypass a lot of that process, and we can certainly help you through that. Cheryl asks, Cheryl is chiming into what Nancy said. Yes, there are persons who have section 13 case management services without waiver. Thank you, Cheryl. Karen asks, so someone on section 50 has declined the waiver, is receiving ICF level services, and the case manager is provided through the ICF. Will individuals on section 50 be entering their PCPs on Evergreen, as we currently do not? Great question, Karen. No, you will, same scenario as EIS. So whatever you're currently entering into EIS for those section 50 ICF clients, or ICF clients, will remain the same. So you, if I think you're probably using the system for reportable events, you'll still use the system for reportable events, but there's no change in person-centered plan capture, data capture. And Karen says, with section 50 ICFs, case management is provided by the social worker. However, the QIDP are deemed the case manager from an EIS standpoint and have entered the assessment information. Will the QIDPs or social workers be the case manager? It will be the same. So the QIDPs will keep their same role. So same process and same roles for individuals in ICFs. Aaron asks, will the forms that we need to attach, example discharge summary, be on the ODES forms protocol website? Yes, Aaron. Any forms that you need in order to complete the discharge checklist will make sure are out on the ODES website and or uploaded within the Evergreen system. So there is a help center section of Evergreen. And if you click on that, it takes you to a place with attachments. So we'll likely upload those right into Evergreen for you as well. So you can access them right from the help center in Evergreen. And it does look like those are all the questions that I have in the Q&A. We do have just a couple minutes left. So I want to thank everybody for joining me bright and early at 8 o'clock on Tuesday. Also in the meeting chat, Miranda has added our project website and our the link to the general page of that website and the link to the training page. So you can find all of those videos. And she's also put our Evergreen email address in there. So go ahead and grab those out of the chat if you don't have them already. And that way you'll have them in case you have any questions between now and our deploy on January 16th. And thank you again. It was really great training with you this morning, and we look forward to supporting you in the Evergreen system.